Physical Education and Sports for Children with Special Needs. Class 11. Content. Concept of disability and disorder. Types of disability, its causes and nature. Intellectual disability, physical disability. Aim and objective of adaptive physical education. Role of various professionals for children with special needs: counselor, occupational therapist, physiotherapist, physical education teacher, speech therapist, and special educator. Introduction. Adapted sports. The sport when played by individuals with certain disability is referred to as adapted sports. Main disability groups: deaf, hearing impairment. Physical disability. Intellectual disability. Concept of disability in simple words: any disadvantage due to which an individual is not able to perform the activities of normal human life is known as disability. According to WHO, a disability is a restriction or lack, resulting from impairment, of ability to perform an activity in the manner or within the range considered normal for a human being. A disability is a functional limitation or restriction of an individual's ability to perform an activity. Concept of disorder. Any disruption due to which an individual is not able to perform his daily human activities is known as disorder. It is usually used for mental disabilities. Disorder cannot be detected on time. As a result, a simple disorder spreads in a harmful manner in an individual in the beginning and later on changed into a disability. Diff. Between disability and disorder. Disability. It is a physical, cognitive, intellectual, mental condition that impairs with or limit a person's ability to engage in certain action or participate in daily activities. No chances to become normal. Disability is concerned with various parts of the body. Disability is of three types: physical, cognitive, and intellectual. Disorder. It is an illness or dysfunctional factor that affect or disrupt the person physically or mentally. High chance to become normal. Disorder is concerned with mental ability. Disorder is of 5 types of ADHD, SPD, ASD, OCD, and OD. Types of disability. Physical disability. Intellectual disability. Cognitive disability. Cognitive disability. Cognitive disability is referred to as a neurological disorder that creates hindrance or obstruction for an individual to produce, store, and process information. Affect an individual's capability to read, compute, speak, and write. In cognitive disability, an individual may suffer from certain symptoms like memory disorder, hyperactivity, and dyslexia. Intellectual disability. A disability characterized by limitations in intellectual functioning, reasoning, learning, problem solving, and adaptive behavior, conceptual, social, and practical skills. It originates before the age of 18. Also known as psychiatric or learning disability. Physical disability. A physical disability is a limitation on an individual's physical functioning, mobility, dexterity, or stamina. Also includes impairments like respiratory disorders, blindness, epilepsy, and sleep disorders. 2 types of physical disability: mobility impairment, motor deficiency, and sensory impairment. Causes of disability. Mental health problems. Disturbance in endocrine glands. Malnutrition. Nuclear accidents. Poor approach to health care. Illnesses. Poverty. Infectious diseases. Dangerous working environment. Accidents. Genetic causes. Toxic materials, pesticides, and insecticides. Wars. Lack of education. Medicines and vaccines. Disability etiquettes. Etiquettes are the acceptable behavior in society with good manners and proper conduct. Disability etiquettes is a set of guidelines dealing specifically with how to approach persons with disabilities. This term is discussed in the disability rights movement. Adapted physical education. According to Adapted Physical Education National Standards, APENS, adapted physical education is physical education which has been adapted or modified so that it is as appropriate for the person with a disability as it is for a person without a disability. In other words, adaptive physical education, APE, is physical education which has been adapted or modified to make it as appropriate for a person who is differently able. Aim and objectives of adapted physical education. To provide every individual an opportunity to participate in physical education and sports and to make physical education accessible to all as per their need. Objectives. 1. To help develop self-esteem in children with special needs. 2. To develop games and activities to promote sports among children with special needs. 3. To develop the capacity to be functionally active for lifetime. 4. Provide safe and secure and accessible sports events to CWSN. 5. Develop discipline regularity among CWSN. 6. To promote sportsmanship. 7. To help each child understand and develop feeling of self-worth and values. 8. To help and understand and appreciate sports and spectator. Strategies to make physical activities accessible for CWSN. Different instructional strategies. Modification of rules. Specific environment. Medical checkup. Activities based on interest. Children's previous experience must be taken into consideration. Advantages of physical activities for CWSN. Physical improvement. Reduced risk of health complications. Reduced level of anxiety, stress and depression. Cognitive benefits. Improved social interaction. Better emotional and psychological health. Self-esteem. Mental improvement. Role of various professionals for CWSN. School counselor. The school counselor is a specialist who works with students with special needs in schools and provides a comprehensive programmer that helps CWSN with their academic goals, their social, personal, and career. Physiotherapist. A physiotherapist is probably the best known of the therapists who works with CWSN. They use exercises to help their patients gain and keep the best possible use of their bodies. Occupational therapist. An occupational therapist trains CWSN in performing assisted daily life skills and self-care skills and activities related to fine motor skills and hand-eye coordination. An occupational therapist also helps children in participating and interacting with others in play. Speech therapist. A speech therapist in school provides treatment, support, and care for students with special needs who have difficulties in communication. Speech therapists help students with special needs to gain ability to communicate through speech and language. Disability etiquettes. Always put the person first. Use person name rather than disabled related word. For example, say person who are blind rather than blind person. Avoid using outdated words, handicap, retarded, physically challenged, differently abled. Shake hands for introduction. Attentive to them and give additional time to person with disability. Treat adult as adult and always avoid asking personal questions from them. Some important other information. Biggest sports event for specially physically abled sportspersons, Paralympics. A sports event for hearing impaired sportspersons, Deaflympics. A sports event for intellectually impaired sportspersons, Special Olympics. Most suitable word used for disabled person is Divyang.